2. Okay. 1, you ready? 2,
Yep.
3, go.
Okay. We're going to test the rhythm of the heart, a 15-second count. Okay, that's about an 80. Heart rate is about 80 beats per minute. So we're going to listen to S1 and S2 at 4 different sites. The aortic, which is the right intercostal space. And the left, move down. So I'm going to listen to the bass, cardiac bass. Okay. And we'll repeat that with a bell to stethoscope. The stethoscope does not have a bell, but we'll go. So it'll be the same. We'll be done the same way. And we're listening to differentiate between the S1 and S2 heart sounds. And at the apex of the heart as well. All right. Now we will position the head of the bed flat, the patient flat. Okay. Let's keep forward just a little bit. Comfortable?
Sure.
Okay. All right. Now we're going to be checking the abdomen for contour, symmetry, skin characteristics, and pulsations, anything abnormal. We're going to check and listen to bowel sounds in the starting in the right lower quadrant, and then up. So right lower, right upper, left lower, and then we'll do the same thing with a bell of the stethoscope. Okay. Then we're gonna percuss a zigzag pattern that's in the same way. So now you need tenderness. Any tenderness? Yeah. Okay. All right, and we've conducted light palpation in all 4 areas because of the percussion. Okay. Now is we're going to check range of motion of the hips.
I'm wearing a skirt.
And she's wearing a skirt, so theoretically we'll be doing straight leg extension. So she would move her legs straight up. Adduction and abduction. Can you just a little bit?
Yeah. I mean,
Okay.
how much am I in the video there, Stephanie?
You're fine.
Okay.
Okay.
So do what now?
And we'll test the strength of the hip. If you can push it up against resistance, okay, and back down, okay. Push up and down, and then through abduction, push out against resistance and left leg. There you go. All right. Any pain?
No.
Nothing abnormal. Okay. All right. Now we're going to be just inspecting for symmetry, skin characteristics, and hair distribution. We'll palpate the pulses of the popliteal, and the posterior tibia, and dorsalis pedis. Okay, and those are present bilaterally. Temperature and no temperature was warm and dry, and there's no edema. So now we're going to test the ankles and the toes against resistance. So there we go, up against resistance and then back down. Okay. And then move your toes. Okay. And now I'm going to do the mid skin reflex. Okay. And on the left side as well. Okay. And if you can move your left heel like this along your shin, and then your right do the same thing all the way up to the knee. Or sorry, yeah, there you go.
Box.
Yeah. All right, and the toes were separate. And capillary refill, we'll test that bilaterally. And that's less than 2 seconds. And then we just tested the cerebellar function by the heel running down the shin on the left leg and the right leg, as well as the Levensky reflex, which we did bilaterally at the bottom of the feet. Okay, if you can sit up and dangle your legs. Alright, and we're going to test the muscle strength of the knees against resistance. So press against, okay, press, and then, okay, there you go. And then we're going to check the deep tendon response. I'm just going to use the side of my hand, I don't have a little hammer. Okay. You can see it, it was a reaction bilaterally. Now we're going to test the light sensation on the face, forearms, hands, lower legs, and feet. Where is my cotton? Oh, thanks. Alright, you can close your eyes and let me know when you feel the cotton.
Yeah. 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 Yeah.
Okay. Alright, that seems to be within the normal limits. Okay. Can you hit pause real quick?
There's not really a pause.
Oh, okay.
And your battery's about to run out, so.
Oh man. Okay. Stereogynous of both hands, position sense. Okay, if you can thumb to fingers. There you go. And then now if you could stand up for me. And if you can walk across the room and turn. And then walk back heel to toe. You okay?
Yep.
Okay. And then walk on your toes for a few steps. And your heels for a few steps. And we assess the Romberg sign for 20 seconds. And is within normal limits. Okay, if you can turn around, I'm going to check your spine. So bend forward just slightly and side to side. You can stand up. Yeah. Side to side and twist side to side. Okay, we're just looking for symmetry and if any abnormalities occur. Alright, if you can do the shallow knee bend, what you do is just like that.
One leg?
Yeah, one leg and the other leg. Okay. Thank you. That concludes the health assessment.
Thank you. Excellent, excellent instruction.